How about the doctor-patient relationship in all this? Do doctors really pay attention? Do they listen? Do they give us more than 23 seconds before they talk?
I do, but absolutely. I think they do. But you know, there are significant constraints right now in the healthcare system. And it's something that is a major issue once again in terms of how do we think about where we're going to go moving forward. There is not much time in a 15-minute visit to do a lot of preventative work. And I think we have to think long and hard about where we're going and the kind of relationships we want, need, and what is the kind of information that is really going to help patients get healthy.
It's a dialogue, Larry. You know, I love it when my patients come in and they've made a list in advance of their questions, so they don't forget to ask them. They've made a list of their medications. An empowered patient who understands the disease and how it should be treated makes a big difference. The physician's going to pay attention. Now, I wished it weren't always, it didn't have to be that way, but there's nothing like a patient that really engages you.
And I would also say that patients need to be empowered to know that every relationship isn't for everybody, and that if it's the wrong relationship and you really feel not listened to,
if you don't like your doctor, go
change.
to
You really
Dr.
do need
Legato,
to do
what
that.
about the patient weighing the benefits, if confronted with it, of stents versus bypass?
That's a huge question, because now the tendency is, as Steve will tell you, is to go to the stent. And most patients don't like the idea of having their chest cracked open.
Well, I didn't.
But bypass leaves you healthy and intact for years and years and years. And so it's a very safe and
But it's a tough call, isn't
very
it?
tough call.
But there are some areas where, for example, certain types of disease, and especially in diabetics, where bypass surgery we know does better than stenting. So I think it isn't a simple question.
What new drugs are you excited about, or treatments?
There's a revolution that's about to happen. We're going to have for the first time final data on studies using drugs that can raise the HDL levels substantially. We think we'll be able to make some people actually have an HDL, a good cholesterol level, higher than their LDL, their bad
Which
cholesterol.
is rare.
Very rare.
And the HDL is like a Drano for your arteries. It actually cleans out some of the bad stuff. That isn't to say to people, wait, because remember, 1/3 of people will die before they get to the hospital or before they get treated. So we really should tell people, we've got a lot of prevention now in lifestyle. 80 to 90% of heart disease can be prevented with lifestyle changes.
The real issue here is that we need to focus our training, our education on the full spectrum of heart disease, which is everything from prevention at the earliest ages through treatment, and really communicating with our patients that prevention is something that's doable and we've got to focus on, but if you end up with the disease, we can help you. And I think, you know, there's hope at every single point along the way, and it's a very important message.
Are statins incredible?
They're incredible drugs. People who have high cholesterol, who lower it with statins, reduces by about 1/3 the risk of heart attack and stroke.
What does it do?
It works in the liver to lower the LDL, the bad cholesterol level.
And why did they put me, along with the Lipitor, they put me on Zetia,
Yes.
which seems to be confronting it double ways, right?
Well,
in the liver and
yeah.
outside the liver.
Ezetimibe or Zetia works in the GI tract, and it actually prevents the absorption of cholesterol from the diet.
So I'm fighting it 3 ways.
You're fighting it several ways. You're fighting it with your exercise, you're fighting it with your diet, and you're fighting it with 2 medications.
Is it possible my body might be confused?
I don't think...
let's say you're my liver.
Well, the only way it's confused, it says, heck, he's 20. What the heck has he got?
No, I think your liver's very happy right now.
I do want to, lipids are incredibly important, and statins have been a real breakthrough. On the other hand, I have patients walking into my office who are on a statin but still smoke, and blood pressure is out of control and are not exercising. And I think, once again, keeping it balanced with all the other things we need to do are very important. It isn't the magic bullet.
When a drug is real good, I had a friend tell me, I take Lipitor, I don't worry about anything.
Exactly.
Right.
I've seen so many patients sit down to a steak more than once a month, mashed potatoes with gravy, and then say, I'm on Lipitor, none of this matters. That's not the idea.
Dusting your cheesecake with a little Lipitor on top, it's not the right way to lower your cholesterol.
What one step would you recommend for a healthier heart?
Stop smoking if you do, and try to exercise every day.
Know your cholesterol, your LDL, your bad cholesterol, and your HDL, your good cholesterol.
Exercise. It is not only good for the heart, but it's so good for preventing so many other things connected to cancer, arthritis, and so many of the things that make us sick.
Walk 30 minutes a day and call someone, call a support person, if you will, to make sure that you and they are staying connected so you have support and a passion for life.
Don't lead a constricted life. Don't avoid things. Construct a life. Ask questions, get help.
The light at the end of the tunnel is brighter.
It's brighter. We have new medications coming that are going to make a big difference. We've got public education campaigns. We have this red dress campaign to make women more aware.
Yeah, great idea.
We have to do all these things. People have to listen. We have to engage the public. And programs like this do help, in fact.
I think it's something we didn't talk about today, but children are critical, and we are seeing more of a movement around childhood obesity, risk factors in children. But if we can teach children to be advocates and to think about their health, it's important.
If you want additional information, please call this 800 number now on your screen. Dr. Marianne Legato, Dr. Steve Nissem, Dr. Paula Johnson, Dr. Michael Roizen, and Sally Foley. Thank you all. We hope you found this as helpful as I did, and we hope that you pay attention. Take care of your heart.
Find out how to lower your own family's risk for heart disease. Download heart-healthy recipes. Learn what entire communities can do, and watch the complete program again online. Visit Take One Step at pbs.org.
This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
To order The Hidden Epidemic on DVD or VHS, please call 1-800-255-9424.
I am PBS.